covering the hip and knee region, biomechanics, and muscle activity during gait. So we're just coming out of the video talking about the pelvis biomechanics. So now we're going to move in, and the first thing that I wanted to look at here is some muscle contractions in the upper leg during walking. So as we look at these graphs, we're going to see many of these graphs as we go through these next couple slides. The thing that I want you to look at here, so at the bottom we have our gait cycle, right? So 0 to 100%. We're going to be going from initial contact through loading response, mid-stance, terminal stance, pre-swing, initial swing, mid-swing, and terminal swing. So as we move through these, we're going to see different muscles at different portions of gait. And you'll notice what's going to happen here is the black is going to indicate some EMG activity, 0 to 100%. So the higher the wave, the more contraction that occurred there. And then they're going to label the muscles here in the middle of the graph. And we'll just roll through several of them. Anytime you look through this and see this gray area, the gray area is an area that sometimes occurred in individuals, but more often it didn't actually happen. However, the black was the consistencies among the individuals. I'll try to point out a couple of general trends to help us kind of realize what's going on here, because it can be a little overwhelming at first to look at these and think, I have to know all these. But if you pause and think for a minute, it should begin to make sense as you begin to work through your kines for walking. Two things I want to point out before we get much further in this video. Remember, one of my goals of these series of videos is to hopefully help convince you that walking is actually a controlled fall. Some of the trends that I will point out as we go through this will highlight this controlled fall. So we generate momentum moving forward, and what our muscles do is our muscles perpetuate, and they carry on the momentum of moving forward. They try to not inhibit that fall going forward. They just try to keep it moving. So the first ones we're going to look at here. So first of all, let's realize the region we're in. We're biceps femoris, semimembranosus, semitendinosus, adductor magnus, and glute max. So we are the hamstrings. We're essentially the hip extensors here in this region. If you can think of where we are, we're on the posterior side of the upper leg, and this is what we're kind of seeing. So let's just look for a general trend. Where are we not contracting our hip extensors? We're not contracting our hip extensors in general from mid-stance through till initial swing. So think about that for a second. From the time we're really bearing weight until the time we're swinging through, our hip extensors are not going to be contracted. There is this one exception in the semitendinosus, which happened in some individuals. So our hip extensors, interestingly, are mainly going to be contracted as we have swung our leg through towards the end of swinging, right, in our terminal stance, in our terminal swing, into our initial contact. And if we begin to think about that, we're like, man, I don't know if that makes a lot of sense. But what we actually see is we have a sharp contraction which keeps our momentum going forward, and then we're going to use our hip extensors in general as stabilizers and eccentrically to help slow our leg down as we swing through. So when you look at these graphs, just realize that we're going to utilize most of these hip extension muscles just to help stabilize our movement going forward and to help slow our leg down during swing, so that when we come down, we're going to have a nice controlled placement of our foot. Let's keep moving. So now we're going to be looking at our hip abductors, our hip abductor muscles, including our glute max, which is actually more of a hip extensor, but it assists in hip abduction. So again, I want you to look for the general trends initially. So we just looked at our glute max. Look at glute max and glute med, how similar these two are. Remember, our glute med and our TFL, these are going to be the main stabilizers for that frontal plane motion. Remember, during from our previous video, during our swing through, our hips, so when on the leg that's bearing weight, the hips are going to move up, and the hips that are not bearing weight or swinging through, the hip that is swinging through is going to drop down in this sinusoidal motion. And so our TFL and our glute med are going to be the muscles that help stabilize our pelvis in that frontal plane, allowing for a little bit of drop for efficient motion, but not allowing for too much. Otherwise, it would be a pathological walk. So we can see that our glute med and our TFL are going to be active as we're bearing weight. And then when we are not bearing weight, they are going to be especially not active. But you can see that pattern there, and then our glute max, we already have discussed that it is essentially off as we bear weight, but we bear the majority of our weight as we swing through, and it is mainly on to help set down our foot and propel us a little bit. Moving in, so now we're going to be looking on the anterior side of our leg at the hip flexor muscles. So we're going to go the opposites of what we were just looking at. And you can see, for the most part, the general trend, if we look at the majority of these muscles are going to be the ones that initiate that forward movement. They keep us moving. These are going to be the muscles that are generally not active during the weight bearing, but they're active during our swing phases. They propel that leg forward to keep our momentum moving in that direction, but then they're going to shut off during weight bearing. Okay, so we've got adductor longus, we've got our rectus femoris, which, remember, this is the one quad muscle that actually crosses the hip joint, our gracilis muscle, sartorius, and iliacus, which is part of the iliopsoas muscle. So again, the general trend is that these muscles are active and on during the swing phases of our gait. And you can see that here. Gracilis, which you'll remember is a muscle that is it's part of our adductor group, and it goes down and crosses the knee joint. It is the most active throughout all of these. It's going to behave as a hip flexor. It's also going to act as a stabilizer as we bring our foot down. So it's going to slow the momentum of our leg and help control our foot as it comes down, so we can have good placement and keep our momentum forward. So these are the muscles that are our hip and knee flexors. So this is that gracilis and sartorius. We just looked at these, but you can see them at a closer angle here. I'm going to move on to the next one. These are specifically hip adductors. So we've seen this adductor longus. We've seen the gracilis now twice. The only one that's different here is our adductor magnus. And our adductor magnus is active mainly at terminal swing into our initial contact. So it's going to be bringing our heel in towards a little bit towards the midline. It's going to be helping us maintain a good movement, a steady movement as our heel hits the ground. And we'll keep moving through. So now we're going to move back into our graphs that we were looking at before with the pelvis. We're going to just be looking at these biomechanics graphs. Realize this one is sagittal plane at the hip. Sagittal plane at the hip. So we're going to be looking at flexion and extension at the hip. Okay? So realize as we go through walking, you guys probably already realize this, we're going to have much more flexion than we have extension. We're just going to have slight extension really as we go into our toe off or our terminal stance, right into that pre-swing or that initial swing. That's the only time we're actually going to extend. The rest of the time, it's about keeping that momentum forward, moving us forward, propelling us forward, right? Just as a quick reminder, realize the middle of the gray area here is going to be our average of the bunch. The gray is going to show our air bars throughout gait, which are going to show the differences between people. So for most people here, we're going to be at about 30 degrees of flexion as we have initial contact. As we move through and that leading leg becomes the lagging leg, we're going to move towards extension. And then once we hit that toe off, so we've extended as far as we're going to obviously move back as we swing through into hip flexion. Hopefully that will make sense as you move a little bit. I wanted to just show you this slide. This is a Dr. Johnson question, but I think it actually is a pertinent question. So based on this graph, would would a decrease in hip flexion or extension affect gait the most? I want you to look at this graph. I want you to think about your ranges of motion uh, that you think we have at the hip. We have about 60 degrees of hip extension. We have a lot of hip flexion. So I want you to just think really quickly, if we lost hip flexion or hip extension, which would be the most pertinent and which one can we lose more of? We'll answer that question in class. Okay, just a couple more slides here. This is transverse plane. Hip rotation, again, so we're looking at internal and external rotation. Realize most people here are going to be right on this 0. There is some variance as people move through their gait. For the most part, people are going to be straightforward. I want you to think really quickly about someone that may be pigeon-toed, or maybe someone that would be duck-footed. Those are going to be our people that help expand this graph, or they contribute to this expanded graph here of our hip rotation from 10 degrees on either side. Moving forward, now I just wanted to cover really quickly, because we covered the muscles in the leg. As part of this video, I wanted to include the biomechanics at the knee. So at the knee, realize our 0 degrees is going to be full extension, unless someone has some hyperextension, right? So this should make sense that this graph never crosses 0. We are going to be fully extended here at initial contact, and you'll see that on both ends. We are starting ourselves at 0 at initial contact at our knee. As we move through gait, you can see the place that we're most flexed is going to be right here in this mid-swing. So realize this knee flexion is going to serve the purpose. As that hip drops down, we're going to have to help flex our knee to allow for swing through without us contacting the ground. Here down at the bottom of this slide, so we have up to about 65 degrees. It's responsible for shortening the length of the leg to allow for foot clearance. So here we get to about 65 degrees. You can see some slight variance. And then we're going to rapidly extend that knee as we approach this initial contact. So we go from 0, we flex, 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 flex. We have maximal flexion here through our mid-swing, about 65 degrees, back to initial contact. Last couple slides here. Knee frontal plane movement. Hopefully this doesn't really come as a surprise here with our knee varus and valgus. So that's the knee moving out or in. Most of this is going to be centered at 0, and you can actually see there's relatively little variance here. Most people are right at 0. We do have some motion that's going to happen here during the swing phase, again, to allow for some foot clearance, but again, it's fairly close to 0. Last one is our transverse plane. So this is the rotation of that knee, internal and external rotation. So you can see once again that there's just very little internal and external rotation of the knee. We're going to be centered here about 10 degrees on that external rotation. Again, just to help us accomplish our gait throughout. You can see that some people are going to be right at 0 in a neutral position, but most people are going to be here externally rotated just slightly. And last slide. So this is our quad muscles. So this is our knee extensor muscles during gait. This is going to be our vastus intermedius, our vastus lateralis, our vastus medialis longus, our vastus medialis oblique, and rectus femoris. So all of our quad muscles here that we're looking at. The thing that I want you to notice here, again, just the general trend, we're going to be super active with our quad muscles during that loading response. Think as we hit the ground at about 0 degrees, and then we're going to have a slight flexion as we move through this range here. And so what this is doing is that these quad muscles are going to be taking some of that impact. They're going to be help stabilizing the knee uh, in an in a concentric way, right? As we move through our terminal swing, we have that sharp approaching of zero. So we're going to help place and stabilize that knee at initial contact on through into our mid stance. Rectus femoris, this one's going to act much more like a hip flexor, so it's going to be active during the swinging phase of gait. And that wraps up this video as hopefully an introduction of the biomechanics and the kinesiology of gait during, or excuse me, not during, but at the hips and the knees and the associated muscles.